This video is about the symptoms of COVID-19 coronavirus. Symptoms of COVID-19. There are 3 known levels of symptoms for the COVID-19 infection. 1. Levels 1, most common symptoms. 2. Levels 2, less common symptoms. 3. Level 3 symptoms, serious symptoms. Levels 1, 3 most common symptoms. 1. Fever. 2. Dry cough. 3. Tiredness, fatigue. 1. Fever. Fever is the most common symptom reported in those who are diagnosed with COVID-19. So much so, that studies have shown, almost 42.8% of the individuals who are tested positive for COVID-19 have a fever at the time of admission, and 88.7% while they get hospitalized due to the severity of the disease. However, one cannot confuse these major symptoms of COVID-19 as a diagnostic tool, which determines if one has a viral infection or not. Individuals who do not have fever might still be positive for the COVID-19 virus, while those who have a fever during this pandemic may also not actually have the virus. Fever has always been considered as a protective response of the body due to a disease or infection. Previous experiments that have been conducted on mammals show that fever might in fact cause resistance to develop in the bodies of these animals against certain infectious viruses, like the herpes simplex virus, poliovirus, influenza virus, gastroenteritis virus, and rabies virus. This was further investigated in a recent study conducted on 201 patients from Wuhan, China, who had been infected with the SARS-CoV-2 virus. The study showed that a high degree of fever in these patients, that is above 39 degrees Celsius, was usually indicative of an acute infection of the respiratory tract, known as acute respiratory distress syndrome. It was also seen that these individuals who had a higher fever were less likely to die from the infection. The individuals who are suffering from COVID-19 may experience fever from the initial days of the infection, as it is the response of the body against the foreign viral particles' infiltration in the blood. But if the feverish state caused by our immune system is unable to get rid of the infection in the initial days of the disease, the condition may be complicated due to a state of dysregulated inflammation caused by the cytokine system. This condition is also known as a cytokine storm, and the fever that may be caused as a result may actually do more harm to the body than protect it. 2. Dry cough. As the name suggests, dry cough doesn't involve mucus production. So unlike a wet cough, every time you cough, you don't feel something moving up your throat, or the need to spit out the phlegm that forms as a result. Instead, you may feel a dry sensation on the back of the throat. And every time you take a breath, you feel the area to be slightly ticklish. So much so, that you feel the need to cough to get rid of the sensation. A dry cough is the second most common symptom associated with COVID-19, as seen in numerous previous studies. One such review investigated the symptoms seen in patients who had been tested positive for COVID-19 and were over the age of 16 years. It included a total of 24,410 individuals belonging to 9 different countries. Even though the study concluded with fever as being the most common symptom, it was seen that cough was the second most common symptom seen in these COVID-positive patients. So much so, that 57% of these patients reported this symptom. The percentage of the population presenting the specific symptoms was found to be different for different countries, but there was not a huge difference, which may change the conclusion of the findings. 3. Tiredness, fatigue. Tiredness or fatigue is another common symptom associated with COVID-19. as reported by numerous patients infected with the virus all over the world. While some studies show it to be found in 44 to 69% of the COVID-positive patients, others conclude it to be found in 34 to 46%. The reason behind the feeling of immense weakness or fatigue that is often found amongst the COVID-positive patients has a lot to do with the activity of cytokines in the body. The cytokines are an important part of your immune system, which helps fight off the foreign infection, which in this case is the SARS-CoV-2 virus. It is the after effect of these actions of the cytokines that may make a person feel immense weakness, as the energy of the entire body has been used up in fighting the virus. Anything you plan on doing requires a lot of effort, and you may feel like your body is entirely drained off of its energy. In February 2020, a report published by the World Health Organization (WHO) not only included the association of fatigue with COVID-19 infection, but also stated it as the third most common symptom found in those who test positive for the SARS-CoV-2 virus. This statement was made after an analysis of almost 56,000 COVID-1 cases found in China that had been confirmed by the laboratory. It was seen that almost 38% of these individuals reported symptoms of fatigue, along with other symptoms, such as fever and dry cough. However, fatigue is a very common symptom of numerous other conditions, and having fatigue does not automatically prove that you may be suffering from COVID-19. It has been suggested by health professionals that instead of assuming that you may have the virus after feeling fatigued or tired, one must try to figure out what may have caused them to experience that symptom. It is up to you to first think that what have I done in the past that I am not feeling this way? Did I wake up till late last night? Did I spend extra hours at the gym? Or have I been experiencing fatigue for no reason at all? You may consult your health care physician to ask for their opinion of whether you need to get tested or not as well. Fatigue is not just a symptom which has been experienced by those who are currently suffering from the SARS-CoV-2 virus, but also those who have recovered from it. Moreover, a study was also conducted to study the symptoms of fatigue found post-COVID infection in 128 individuals. These individuals were evaluated for their symptoms, their COVID severity, the immune markers, and any inflammatory mediators in their blood. The results showed that the majority of these individuals reported symptoms of fatigue even after 10 weeks of their diagnosis with COVID-10. 2. Levels 2. 8 less common symptoms. 1. Body ache and pain. 2. Sore throat. 3. Diarrhea symptoms. 4. Conjunctivitis. 5. Headache. 6. Loss of taste and smell. 7. Skin rashes. 8. Finger and toes discoloration. 1. Body ache and pain. Myositis, which is also known as muscle pain, is mainly caused by an inflammation in the muscles of the body. It may present itself as a dull pain, usually in moving the muscles or changing the position of the body. Having body aches and muscle pain is a symptom which may be seen in COVID-19 infection, although not as commonly as fever, cough, and fatigue. The cause of its association with the recent COVID infection is that the virus causing the infection, known as SARS-CoV-19, may cause inflammation of the muscles. By inducing inflammation, the virus may in turn damage the fibers of the muscles. Moreover, by the hyperactivity of the cytokines against the foreign viral particles in the blood, an intense inflammatory response may be triggered, which further causes the damage of the muscles due to abnormal tissue damage. The muscle pain, which is usually seen in COVID-19 patients, is explained as intense pain, which is caused by the muscles being touched or moved. One way to differentiate this type of pain from that caused by exercise or workout is that the pain caused by COVID-19 is more general, causing it to be felt all over the body, while that caused by exercise is more localized to a particular muscle, which was used more. Another difference between the two is the time period that the pain lasts. The muscle pain caused by COVID infection lasts much longer than by exercise, which is seen to resolve within 1-2 days in the majority of cases. 2. Sore throat. Sore throat is a common sensation most of us have felt at some point in our life. It is characterized by a scratchy feeling in the throat, or you feel deep pain when you try to talk. As the COVID-19 virus greatly affects the respiratory tract, it may also cause a person to experience a sore throat due to inflammation of the upper respiratory tract. The sore throat was also recently added by the CDC as a new sign of COVID-19, along with others, like dry cough, shortness of breath, fever, chills, headache, loss of smell and taste, and muscular pain. Since it is a fairly recently discovered sign of COVID, it cannot yet be deduced at which point exactly during the course of the infection it occurs. For example, for the common cold, which everyone has experienced at some point during their life, a sore throat can be felt pretty early on. The logic behind this is that the mode of entry of respiratory virus is usually through the nose or the mouth. Hence they immediately come in contact with the throat after their entrance and affect this part of the body first. However, sore throat is not a frequently encountered symptom of COVID-19. In fact, a recent report by WHO has reported this particular symptom to be present in only 13.9% of those who have been tested positive for the virus. Another recent study was conducted where the symptoms of COVID-positive patients were evaluated. The study was conducted on 9 children and 14 adults who were admitted to the Jinan Infectious Disease Hospital of Shandong University. The main symptoms reported in these individuals were fever, cough, chest tightness, and fatigue, while only 7.1% reported symptoms of sore throat. 3. Diarrhea symptoms. Diarrhea is defined as the passage of more than 3 stools per day. Diarrhea is another uncommon symptom that has been recently associated with COVID-19 infection. In fact, studies have shown it to be present in 8.1% of infected individuals. However, unlike other symptoms associated with COVID, diarrhea is usually a late-onset symptom, which means that it is experienced by the patient late in the disease. Previous reports have also proven it to be only present in those cases of COVID-19 which have prolonged symptoms, or whose symptoms last for more than 10 days. It has not been reported in individuals who had mild symptoms that subdued particularly early on, or a few days after their onset. The symptoms of diarrhea in COVID-positive patients were further evaluated on a study evaluating the data records of at least 1099 patients of COVID-19 belonging from China, who had been diagnosed up to January 2020. The results showed that out of these 1099 individuals, only 42 individuals experienced diarrhea, making a percentage of only 3.8%. It was also seen that 6% of these patients had their symptoms worse, up to a point that they were admitted into the intensive care unit. 4. Conjunctivitis. Conjunctivitis is a condition affecting the eyes, and is usually referred to as pink eye, due to its appearance. It is characterized by intense redness of the eyes, swelling of the eyes, and itchiness of the eyes, and has been associated with the COVID-19 infection. In rare cases of 1 to 3%. This occurs when the virus comes in contact with the conjunctiva of the eyes, which is the white part of the eyes, and causes inflammation in the eyes. The association of conjunctivitis with COVID-19 was further investigated in a study, including a number of instances when the tears of a person are seen to contain the virus, with the helping of specific testing methods, like reverse transcriptase polymerase chain reactions. The study included the case of a health professional who reported sudden development of symptoms of pain, redness, stinging, and photophobia, after which they reported to an ophthalmologist. Even though the patient did not have any signs of respiratory distress, cough, fever, or fatigue, which are the common symptoms associated with the virus, he was found to have COVID-19. As concluded by undertaking various tests, PCR, blood analysis, and CT scan. The study concluded by stating conjunctivitis to be a possible sole symptom of COVID-19, even in the absence of some other more common symptoms. Hence, it is important to count the conjunctiva tissues in your eyes as a possible mode of entry for the virus into the body, and one should try to protect their eyes, along with their nasal entrance passages, against the SARS-CoV-2 virus. 5. Headache. When it comes to neurological symptoms associated with COVID-19, headache is probably the most common one may experience. The headaches that can be experienced by a patient suffering from the viral disease may be divided into different categories, depending on the time at which they appear in the disease. The first phase of most viral infections is known as the influenza-like phase, and headaches, like primary cough headache and tension-type headache, may be seen in a particular phase. The second phase of the disease, which may also be known as the cytokine storm phase, may contain types of headaches that are associated with a lack of oxygen or hypoxia, even though it is not a very common symptom of the COVID-19 viral infection. A headache may be found in 8 to 12% of all the people who have been tested positive for the virus. More than 41,000 COVID-19 patients have been included in clinical studies, and headache was present in 8% to 12% of them. A study was conducted to further evaluate the incidence of headache in COVID-positive patients by asking them to fill out a web-based questionnaire. There were a total of 3,458 individuals to participate in the study, and were grouped according to their current infection state and the type of headache they may have experienced. Out of these individuals, at least 262 were tested positive for the virus, and those who reported experiencing headache as one of their symptoms described it as either pulsating, pressing, or stabbing. It was also seen that the onset of headache in these individuals was associated with some other symptoms, like anosmia, ageusia, and gastrointestinal problems. 6. Loss of taste and smell. Anosmia is the loss of smell, and may often result from viral infections. In fact, it is so common that more than 40% of the cases of anosmia are after effects of a recent viral infection. This is because most of the infections are responsible for affecting the upper respiratory tract, which is the part of our body that is concerned with the smell. One of these viral infections was also the previous strains of coronavirus, which have affected the world in the past. Hence, it is not a surprise that the newest coronavirus strain that is currently causing the global pandemic may also present itself with significant anosmia, because your sense of smell is connected with your sense of taste. The two are usually found to occur simultaneously in those who are tested positive for COVID. That 95% of the time, when people are unable to taste something, they are also unable to smell at the same time. A number of health professionals around the world have reported patients coming to them with no symptoms of COVID-19, other than a total loss of taste and smell. The reason behind the diminished or lost sense of smell and taste in COVID-19 patients is due to the ability of the SARS-CoV-2, which is the virus responsible for causing COVID-19, to bind to certain proteins on host cells called ACE2. These are present in a significant amount in the mucosa lining our nose and our mouth. And the interaction of these proteins with the virus may be one reason for the symptoms. Another possible explanation for the loss of smell and taste is the virus might have the potential to directly attack the nerve cells and damage them until they are no longer able to carry the taste and smell stimuli to the brain. This was further investigated in a review conducted using the data from multiple sources, like Ovid Medline, EBSCO AD Web of Science, ranging in the time period between December 2019 and May 2020. There were a total of 11,054 individuals who were included in the study, and were all COVID-19 patients. The results showed that the loss of smell was found in almost 75% ambulatory and 81% hospitalized COVID-19 patients. 7. Skin rashes. ENANTHEM is the tiny rashes that may appear as small spots on the mucous membrane lining the body. The appearance of the skin is also a symptom of COVID-19 and has been previously reported in at least 18 COVID-positive patients from Italy. These skin rashes that are found in association with COVID-19 are described as either erythematous rashes or urticaria or even vesicles that look like chickenpox. Some other resorts have also illustrated them as purpuric and petechial changes on the skin. These skin presentations were further investigated in a study conducted on 21 patients who were tested positive for the novel coronavirus via reverse transcriptase polymerase chain reaction using OROPHARYNGEAL or nasopharyngeal swabs. Out of these patients, those who experienced intraoral skin rashes were separately examined systemically, and their symptoms were fully analyzed. It was seen that one COVID-positive patient had skin rashes that appeared as papulo vesicular lesions. 2 had those that resembled purpuric PERI FLEXURAL skin rashes, while 3 patients had rashes that presented themselves as erythema multiforme. 8. Finger and toes discoloration. One unique symptom that may present itself in those who test positive for the coronavirus is finger or toe discoloration. This has led to the introduction of a new term known as COVID toes, which is quite similar to another condition of discoloration known as pernio, which is characterized by sudden swelling, reddening of one or more than one toe, and blister formation of one or more than one toe. The discoloration that is seen in COVID patients may occur over a period of numerous days. Hence it is not amongst the first signs of the infection. Even though it may initially present itself as bright red color, it may start to darken after a few days until it turns a deep purplish color. The toes may even show the appearance of small bulbs or whitish sores, along with the discoloration. Those who have experienced the symptoms have also explained it to be similar to chilblains, which is a reaction on the skin in response to cold. However, this discoloration is not only limited to the toes, but may also be found to appear on the fingers of a person. Dermatologists all around the world have diagnosed and reported a rapid increase in the incidences of these symptoms accompanying the COVID-19 virus, even though they were considered to be very rare in the past. Another fascinating discovery about these particular symptoms is that it usually appears within the members of the same family, hence hinting towards a potential genetic link. Overall, studies have shown it to appear later on in the disease process, and in the young and mildly symptomatic individuals. Level 3 symptoms. 3 very serious symptoms. 1. Breathing difficulty and shortness of breath. 2. Chest pain. 3. Loss of movement. 1. Breathing difficulty and shortness of breath. Shortness of breath is a feeling of fighting for air and not getting enough to be able to take a deep breath. This is usually associated with chest tightness, along with increased heart rate, and does not necessarily have to be accompanied by an exercise. It may occur while the person is in a resting state, as well. Breathing difficulty is a symptom of prolonged COVID-19 infection, and the appearance of this symptom should be a ringing bell for the patient, if they are already positive for the SARS-CoV-2 virus. However, shortness of breath is not only minted to the COVID-19 infection, but is found to be present in a number of other conditions. Hence, one must analyze when and for how long this symptom lasts, and if it is associated with another symptom. For example, if someone is diagnosed with COVID-19, and after a week of fever and dry cough, they all of a sudden start to experience breathing difficulties, that is when they should immediately go to the hospital and report their symptoms, as this may be associated with progressive lung damage. One factor that can help differentiate the shortness of breath that appears is a progressive COVID infection from that which appears in other conditions, is when one experiences breathing difficulty, along with a significant drop in the oxygen saturation of their blood, especially without any exercise. According to a recent report by the Center for Disease Control and Prevention (CDC), at least 31 to 40% of the individuals who have tested positive for the COVID-19 virus experience symptoms of shortness of breath. The association between SARS-CoV-2 and breathing difficulties is that it causes the immune system of your body to affect the oxygen supply from the lungs to the blood. It does this by causing cytokine release by the white blood cells in response to the foreign viral particle in the blood, which in turn causes excessive pus discharge and accumulation in the lungs. These accumulations in the respiratory system are usually associated with certain symptoms, like persistent coughing, feverish state, and breathing problems. Why it is essential to contact your health professional when you feel like your breathing problems are not getting better is that when one is not able to breathe properly, it usually results in loss of the oxygen saturation of blood, as the lungs are unable to perform their function properly. Hence, when your oxygen saturation falls below 90, it is considered an alarming stage, and the lack of saturation may result in the brain not getting enough oxygen, which in turn may result in brain damage. Hence, one must immediately consult a health professional when they experience such symptoms. 2. Chest pain. Even though chest pain is not considered a very common symptom of COVID-19 infection, and is even listed by the Center for Disease Control and Prevention as an established symptom of the infection, that does not make it any less important. Recently, a number of people all over the world have reported the experience of chest pain after testing positive for the COVID-19 virus. And there may be numerous reasons for its presentation. Health professionals have concluded that this feeling of pain in the chest may be caused by persistent coughing, which is a common symptom of the infection. This type of chest pain is usually explained by those experiencing it as a general feeling of soreness in the chest, which differentiates it from a possible rib fracture or muscle sprain, which is usually more localized. Furthermore, the chest pain that is experienced in angina is also different from the one experienced in COVID-19, as it is not reported to be spreading to the left arm, the jaw, or neck, and is not associated with sweating. Moreover, if someone has chest pain, which is associated with other common COVID symptoms, like fever, cough, and loss of smell, then it is much easier to make the diagnosis. However, if there is only a feeling of minor chest pain, without the appearance of any other symptoms, there is a possibility of it being something else, and one should consult a doctor as soon as possible. 3. Loss of movement. A very rare but serious symptom of COVID-19 has been reported to be the loss of movement, which is associated with the psychological aspects of the disease. There have been recent reports of such symptoms in those who have been tested positive for the SARS-CoV-2 in regions of Taiwan. A previous study was conducted, where almost 2,000 participants were recruited via social media platforms like Facebook. These participants were asked about their psychological health, their physical health, their mental health, and social support during the recent COVID-19 pandemic. The results showed that almost 13% of them responded by reporting altered physical health, while 19% reported changes in physical health due to the current situation around them. It has been proposed that the reason behind these changes may be their fear of the pandemic and how it is affecting everyone around them. Another case report showed the effect of altered mental health and motor functions as a result of the COVID-19 virus. It states how a woman who worked as an in-house nurse was tested positive for the coronavirus at the age of 39 years, and no history of previous mental or physical health conditions. After a few days of the diagnosis, she started experiencing unusual tremors in her lower limbs, and continued, despite the changes in her position. It was noted that when she was tested negative for the coronavirus, her symptoms started to improve, until they were completely gone on psychiatric examination. Later on, it was revealed that she had one before in her life experienced similar symptoms out of immense fear when she was rock climbing. The study concluded by stating that the unusual motor symptoms were caused by the fear of the virus that had developed in the patient's heart, and it should always be considered when evaluating a patient for their COVID-19 related symptoms. Here ends this video on the symptoms of COVID-19. Don't forget to check out the other COVID-19 videos on this channel. If you found the video valuable, like, comment, share, and subscribe to receive alerts when we produce these types of videos in the future. Subscription to YouTube is totally free. Thanks for watching. Note: this information is for education and reference only. It is not meant to replace the informed advice of your doctor. If you believe that you have a health problem, do not resort to self-help. Please consult your doctor or health care provider. We hope you enjoyed this video. See you again soon.